Hello, my name is Villalon-Arriaga, and today I will be presenting how Kolcaba's theory of comfort can be operationalized to guide nursing interventions addressing postpartum hemorrhage, or PPH. This presentation connects as a well-established middle-range nursing theory with a critical maternal health problem to demonstrate how theory can strengthen clinical practice and improve outcomes. So the practice problem in question is postpartum hemorrhage, or PPH. Postpartum hemorrhage remains one of the leading causes of maternal mortality worldwide, responsible for nearly a quarter of all maternal deaths, according to the World Health Organization. In the United States, the CDC reports that 2 to 5% of deliveries involve postpartum hemorrhage, making it a significant national concern. Clinically, postpartum hemorrhage is defined as more than 500 mLs of blood loss after a vaginal delivery or more than 1,000 mLs after a cesarean delivery. Because hemorrhage can progress rapidly and unpredictably, early recognition and rapid action are essential. Nurses often identify the earliest signs, such as increased bleeding, tachycardia, or uterine atony, and therefore play a central role in preventing poor outcomes. To align this practice problem with Kolcaba's theory of comfort, we begin by defining key concepts. Postpartum hemorrhage refers to excessive blood loss that threatens the mother's hemodynamic stability and can lead to shock, organ failure, or death if untreated. Kolcaba defines comfort as an experience of being strengthened through relief, which addresses immediate physical needs, ease, which reduces anxiety and emotional distress, and transcendence, which allows the patient to rise above the crisis and regain emotional control. These are assessed within 4 contexts: physical, psychospiritual, social, cultural, and environmental. Together, these concepts create a holistic lens for understanding the patient needs during a postpartum hemorrhage event. Key components of Kolcaba's theory of comfort is on this next slide. Kolcaba's theory of comfort is a middle-range theory, making it practical and directly applicable to clinical settings. The model emphasizes that when patients' comfort needs are met across the 4 contexts, they demonstrate improved health-seeking behaviors, stronger coping, and better overall recovery. The 3 types of comfort, which include relief, ease, and transcendence, form the structure for assessing and responding to patient needs. Kolcaba's framework is especially valuable in maternal health because it supports not only the patient's psychological needs, but also their emotional, social, and environmental needs during a crisis. This circular model represents how comfort needs evolve through a postpartum hemorrhage event. A hemorrhage creates immediate physical danger, but it also results in intense fear, anxiety, and distress for both the patient and the family. Nurses implement comfort-centered interventions that support the patient during the crisis. These interventions lead to the 3 comfort outcomes: relief through physical stabilization, ease through reduced distress, and transcendence through emotional strengthening. When comfort is achieved, the patient experiences better clinical outcomes, improved coping, and more positive perceptions of their birth and recovery experience. The model is circular because comfort needs shift as the patient stabilizes and recovers. To operationalize this theory in real practice, nursing actions must be intentionally aligned with the 4 contexts of comfort. In the physical context, nurses assess blood loss, administer uterotonics, provide IV fluids, and monitor vital signs. In the psychospiritual context, nurses offer reassurance, explain procedures, explain interventions clearly, and address fear or anxiety the patient may be feeling. The social cultural context includes incorporating family support, respecting cultural beliefs, and communicating in ways that align with the patient's background. The environmental context focuses on maintaining a safe, calm, and private environment during the emergency. Comfort outcomes are then evaluated using patient feedback, anxiety levels, and physiological stabilization. The intervention developed for this project is a comfort-focused postpartum hemorrhage response protocol. It incorporates evidence-based clinical actions such as the use of quantified blood loss, administering uterotonics, and initiating rapid fluid replacement with comfort measures drawn from Kolcaba's theory. Nurses remain at the bedside, providing continuous reassurance, explaining procedures as they occur, and helping the patient feel safe during a frightening and unexpected event. Family involvement is encouraged when appropriate, and staff intentionally keep the environment quiet, organized, and comforting. This combined approach promotes relief from physiological distress, emotional ease, and ultimately transcendence. This intervention is strongly supported by the literature. Begley and colleagues found that structured, team-based approaches to postpartum hemorrhage significantly reduce morbidity. Kolcaba's research consistently demonstrate that comfort interventions enhance patient coping and emotional recovery. Family-centered and culturally sensitive care have been shown to improve patient satisfaction and psychological outcomes. Main and colleagues have demonstrated that using quantified blood loss results in earlier detection and better management of postpartum hemorrhage. Finally, both the WHO and CDC emphasize rapid, coordinated, and holistic responses to obstetric emergencies. Integration involves embedding comfort assessments into regular postpartum documentation, ensuring nurses evaluate both physical and emotional needs. Staff education should include training on Kolcaba's comfort principles and how to apply them during postpartum hemorrhage emergencies. Evaluation metrics may include time to intervene or time to the intervention, reduction in patient anxiety, patient satisfaction scores, and postpartum complication and readmission rates. By monitoring these outcomes, healthcare teams can determine the effectiveness of this comfort-centered intervention and make improvements where needed. In conclusion, Kolcaba's theory of comfort offers a holistic, patient-centered framework for managing postpartum hemorrhage. By addressing both physical and emotional needs, nurses are able to deliver care that is not only clinically effective, but also compassionate and supportive. Operationalization of this theory through a structured postpartum hemorrhage response protocol enhances patient maternal safety, improves patient experience, and strengthens the role of nursing in maternal health care. These are my references. Thank you so much for listening to my presentation.